So to review, both of these therapies are potentially options for patients with relapsed aggressive B-cell lymphomas. And what we wanted to do in our research is look at the patients who actually receive either stem cell transplant or CAR-T, not patients who are necessarily designated to receive one or the other from the beginning, because patients may not ultimately receive the therapy they're intended for a variety of reasons. And when we did that, we saw the patients that received autologous stem cell transplantation and the second-line therapy had very good long-term survival outcomes. Approximately half to 60% of patients were free of disease 5 years later. And when we looked at the proportion of patients that received CAR-T cells in the third-line setting or beyond, roughly 25% of those patients were in remission without additional treatment 3 years later. And there's a discrepancy between these two therapies and also the patients that receive them. So what we attempted to do is a landmark analysis to look at patients that had achieved a remission for a certain period of time after each therapy to see what the quality of ongoing remission would be. And when we did that through a series of landmark analyses, we saw that at 3, 6, 12, and 24 months after the cellular therapy, patients who received stem cell transplant were more likely to remain in remission than those that had received CAR-T. And we think this is important because stem cell transplant has fallen out of favor a little bit for CAR-T therapy, particularly for patients with early relapses, but we can see that it is a very durable therapy for patients. And if there were ways to understand who might respond well to a stem cell transplant, that therapy could be offered to those patients, and perhaps then others would avoid a stem cell transplant and go directly to CAR-T in the second line.